I just stepped out of the room with another patient who got the coronary artery calcium scan. And he was advised by his doctor to get another test, which is a nuclear stress test. And I told him, stop, just stop all this. And it's fortunate because he came here for a second opinion. Now, here's why I said stop. Number one, the radiation-based test of a CT scan is not necessary. It is dangerous radiation. It does cause DNA breaks and ultimately leads to cancer. But what happened was it led to a cascade of events where he gets the scan and then they recommend a stress test, which he doesn't need because he doesn't have any symptoms. And then they recommend pharmaceuticals, which lower numbers down, but don't meaningfully lower your risk of heart attack, stroke, and dying. And he heard this message before, and I'm telling you the same message that he received. And that's why he was here for consultation. So if you did get the coronary scan, I don't recommend pharmaceuticals. I recommend natural treatment approaches. If you are thinking about a scan, I would advise you not to, because just save the radiation. Now you can work with us, you can work with your local doctor, get the most advanced blood, urine, stool testing in the world and see what your real risk is. But that's the problem, is that the CT scan leads to drugs, it leads to more tests, none of which makes you healthier. I should know, I've been doing this for over 20 years. I was born into the cardiology world with my father as a cardiologist. There's a much better way. So work with us at Natural Heart Doctor, read my blogs, read my information, work with one of our physicians, do our tests, check out our supplements, whatever it may be. But take a breath in, relax, don't make any rash decisions with your local doctor, and think about working with us at Natural Heart Doctor, your home for the 100-year heart. Clarity, vitality, longevity, without the drugs and the dangerous procedures.